Hi, Dr. Pelto here. I'm going to talk about a patient that I saw in the office. This was a 58-year-old female, and she had bulbous changes to the back of her Achilles. So I want to share the story of what happened to her. So this patient, what she was doing is she had her dog, and she was trying to go down some stairs. And what happened as she was going down these stairs, she felt a little bit of a rip happen in the back of her ankle, and it was actually in the area of the Achilles tendon. Now, she had a history of plantar fasciitis, which is a problem that can happen on the bottom of the heel. And with the plantar fascia, she didn't have any restrictions. She could do whatever she wanted. And even with the Achilles, after she felt that pull, she could do whatever she wanted. But progressively, what happened is that the pain became worse. And she liked to walk. This woman, she walked about 2 to 3 miles a day. And she was wearing her orthotics like she had got from her previous podiatrist. And really, nothing was really helping. She tried different types of stretches to see if that would help. She kind of looked on the internet to see what she could do. And she had also taken naproxen or different types of anti-inflammatories because she was having to take those. Now, before, she didn't have to take any, but now, because of her Achilles pain, she was even having to take naproxen. And then the problem was this went on and on and on. It didn't get better. And then she started to limp after about a year. She was limping. She was trying to do icing, and the types of stretching we found out later that she was trying to do was a little inappropriate, and it actually caused things to get a little bit worse. And she loved to golf. And even when golfing, like, she was limping. And so she really just changed her life because of this condition of Achilles tendonitis. She stopped golfing, she stopped jogging, she stopped doing her spinning that she liked to do. All of this because it hurt and she didn't know what to do. So she came to see me at about 3 years after changing shoes, after changing everything and trying everything that she could. And she was having this pain that was causing her once again to limp. So what do we do? Certainly we can get an x-ray, but really an ultrasound is much better. And this is an example of an ultrasound of an Achilles tendon. You can see here at one end of the tendon and the other end of the tendon, and this is what we call bulbous changes. So it looks like a bulb a little bit, kind of like spread out like that, almost like an onion bulb maybe. And the area black, that is inflammation. And you can see how the fibers, they're not nice and normal. They kind of look a little odd. Here's another example of the fibers coming down and as they insert into the back of the heel bone. And once again, these are the darkness, that areas of swelling. And that's what her ultrasound looked like when she came into the office. So when we see that, there's something wrong. There's something injured. Now, why doesn't this injury get better after 3 years? Well, usually it's because it's chronically inflamed and she's always on the thing, okay? And so you can see once again here, it's just thick. It doesn't look normal. And the ultrasound is really what helps us to see these things. Well, what did we do with her? Well, we started with an exam. We pushed on the area. She started to do some physical therapy. I always think people get better faster with physical therapy. But in this specific condition, it's not an area that you can do cortisone injection, for example. So we have to use some new advanced treatments. And one of those, besides the stretching and the physical therapy, one thing, by the way, when she was working, she found that she was weak in her core. And so I think core strengthening is something that's real important when you're dealing with Achilles or plantar fasciitis. It's not so much the foot, it's how the body moves over the foot. And we ended up doing for her 3 sessions of combo Shockwave. So the combo Shockwave, this is the radial Shockwave, and it's kind of like it like hits the area and makes sound waves, and these bust up that area of inflammation and actually re-injures the Achilles tendon so that it'll heal to increase the good blood flow to that area. And we also did focused Shockwave, actually not here, but back on the Achilles. And after the 3 sessions, we did a session, takes about 15 minutes. We do those a week apart. And she was at 6 weeks out, she was about 75% better. Now, she had some older orthotics, and her orthotics, they were 3/4 length. A lot of times we'll cut them right here, but she was noticing some blistering from her orthotic. That's where we got her a new pair of orthotics. Now, custom orthotics are a lot different than over-the-counter. So if you have over-the-counter, I find orthotics can work well. Not always in Achilles. I want to be very clear. Achilles can sometimes help because you're stabilizing the heel. But this woman, she was super happy. After 3 sessions, once again, she had been paying for 3 years. She was limping around. She was about 75% better after 3 sessions. She was not limping. She still had a little bit of mild pain after 6 weeks after these treatments, but it was night and day. And the ultrasounds after showed that there was less swelling in the tissue. So what do I use to treat Achilles tendonitis? This is my Achilles tendonitis treatment checklist. Once again, if you want it, I'll put a little link underneath it. But this is what I use for my patients. And for her, we did ultrasound. We wanted to repair and heal the tissue, okay, not just reduce the inflammation. Because if you reduce the inflammation, it'll help temporarily, but repairing it is what Shockwave did. So I think Shockwave is great, really, really works well for our patients. Some patients also do amnio injections or platelet-rich plasma injections. She did all these things. She did the towel stretch, home therapy, physical therapy, night splint. We tried taping her foot, put a supportive shoe on there. She had custom orthotics. I don't think we did an ankle foot orthotic on her, but really the one that changed everything was this Shockwave treatment. We find it very, very effective. So if you guys want to learn more about this, I put together this booklet. It's called The Healthy Living Guide to Achilles. I give it to my patients for free and those that watch my videos on YouTube and other places. Once again, if you want that, I'll put a little link underneath it, and there might be a little link above it. And I'll be developing also some courses and different type of recommendations. Once again, this does not replace medical care, but I just wanted to share my experience of this woman that had this bulbous changes, and I think it'll help you as well. Okay, thanks.